Hey everybody, so you had a total knee replacement for watching the video, and your knee is swelling, as we expect it to swell, and your main goal right out of the gate with your rehab is you want full range of motion. Full range of motion meaning that you can completely extend your knee and you can completely bend your knee. Now, particularly when it comes to bending your knee, I think there's one thing that you really need to know that a lot of PTs may not actually know either. And I say this after being a PT for 13 years, treating probably hundreds of people with total knee replacements, and after 13 years I'm just kind of really grasping this, understanding it, and starting to train RPTs at the clinic a little more on it. So this is what I feel is the number one range of motion secret that a lot of therapists, including most of the therapists I know, really don't know with a total knee replacement. And so what it is, and I've covered it a little bit in other videos where I've mentioned it before, but essentially what really limits your ability to achieve full range of motion, especially your ability to bend your knee, is the swelling in the knee. So if you're watching this and you've had a total knee replacement, or you know someone who has, you can probably attest to the fact that when you're trying to bend your knee in those first few weeks after total knee replacement surgery, you can just feel the pressure. The knee is swollen, it's tight, and depending on your pain tolerance, you're basically just expected to push through as much pain as you can, and you're told that if you do, that's going to help you achieve full range of motion. Now again, that's what I've been telling people for over a decade. Sometimes it works, sometimes it doesn't work. Also, of course, we're telling you to do things to decrease your swelling like ice and elevate and things like that. But really, I think what a better solution is to really, really focus less on stretching through that pain and more on decreasing the swelling as much as you can. Now, obviously, I just kind of rattled off a little bit of the standard advice when it comes to decreasing your swelling. We tell our clients, don't do too much activity. Don't do too little either, though, because you don't want to be a couch potato and get really stiff. We tell them that. We tell them to ice. We tell them to elevate. There's some other tips we can throw in there along the way. But really, I think what you need to do is if you're working with a PT, you need to pick their brain and kind of be your own advocate. And you need to say, what can you do to decrease the swelling throughout that whole side of my body, the whole side of my leg? Because what you may find, especially if you had swelling in that leg before surgery, is that those two systems I talked about in another video, your veins and your lymphatic system, those two systems are all the way backed up. Now, they're not just backed up in your knee, they're backed up all throughout the entire leg as the leg is draining in towards like your groin and your abdomen, and ultimately with your lymphatic system is draining all the way up into your upper body towards your chest. So with your PT, you need to be, I think, a little more direct and say, can we clear up those systems? Is there something you can do to help clear out my venous system? Is there something you can do to help clear out the lymphatic system? Because if we can just create a pathway for all this fluid to flow back into the normal blood supply, more than likely my knee range of motion, my flexibility is just going to improve all on its own without me having to take all these narcotic painkillers so I can push through the pain and just struggle for the next however many weeks, 6 weeks, 8 weeks, and then you're worried about persistent knee swelling for 6 months to a year to 2 years, things like that. So again, that's the tip here. I think it's a secret that a lot of PTs don't know, and again, I didn't really know until I started working more hand in hand with our lymphedema therapists here at the clinic. So be your own advocate, do some research, and again, the easiest way I think to achieve full knee range of motion, especially when you're looking at bending of the knee or flexion, is get that swelling down. Really focus on getting it down. Everything you can do. Probably in another couple weeks, I'll post another video about simple ways to decrease swelling in the leg at home. I don't have it queued up right yet, but I'll probably add that link back in after I can circle around. In the meantime, if you have questions or comments, I'd love to hear from you. Please leave it below the video and I'll get right back to you. And please subscribe while you're there if you like what you see and would like to support the channel. Thanks for watching.